Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. And we're excited to bring you this conversation about the move to MEDITECH Expanse and how to transition your data, which I think is such an important topic. I've been writing about EHR for 15 years, and it's amazing how this topic is eternal because we want to keep our data, and the data is becoming so valuable to an organization, but doing it in the right way really matters. So I'm excited to have two experts here to kind of discuss this as you move to Expanse. What do you need to do? What's the right approach? So we'll ask our two participants to introduce themselves. First, Jay, you want to start?
Sure. Thanks, John. Thanks for having me today. My name is Jay Deering. I'm a director in the Client Services Division here at MEDITECH. In my role, I oversee the Expanse implementation conversions, focusing on platform migrations and data conversions to our Expanse platform. I've been at MEDITECH for 19 years, and I have served in leadership roles across both our implementation and service groups across all of our platforms.
Awesome. Welcome, Jay. Looking forward to hearing your experience. And Taylor?
Yeah, thanks, John. Thanks for having me. As you mentioned, my name is Taylor Mawyer. I am a managing consultant at Galen Healthcare with 13 years of health IT experience leading technical teams in the healthcare delivery and consulting spaces. Prior to coming to Galen, I served for 7 years as IT director for a large orthopedic practice here in Virginia, which is where I live. And then in my current role at Galen, I'm fortunate enough to lead a team of extremely talented data migration consultants and analysts that allow me to focus on helping them and supporting strategic initiatives such as this conversation about transitioning your data to Expanse.
Awesome. Thanks, guys. And I think we want to dive in deep into the migration, but before we get there, I think it would be remiss to us not to talk about one, how is Expanse being received in the marketplace, Jay? And, how has COVID-19 impacted Expanse as well?
Yeah, sure. Thanks. As far as Expanse goes, there continues to be a lot of momentum in the marketplace regarding our Expanse platform. It's our newest, latest, and greatest. It's fully interoperable, web-based EHR platform, navigates the entire care continuum so that you can see the full picture and treat the whole patient, no matter where you are in your organization. Several of our customers have commented about the mobility and intuitive navigation of the Expanse solution. Expanse's intuitive design, mobility, interoperability help physicians increase efficiency and improve patient care. So above that, it was designed by physicians for physicians. So it's great to see the continued excitement and buzz in and around our user community.
Yeah, that's great. And has COVID-19 impacted I think there were a bunch of people looking. Has COVID-19 slowed that? And, what's been the approach? You now have to support customers virtually.
Yeah, absolutely. I can certainly start and hand over to Taylor, but from a MEDITECH perspective, customers have continued to move forward with go lives in Expanse, including updates, on-prem installs, and even our mass installs with virtual support. Some of our customers have had to delay plans due to COVID, but we're now seeing those customers re-engage and moving forward again. So it's a good sign.
Yeah, we're seeing something similar as Jay mentioned. Our focus is helping clients implement and migrate their data. And so as the COVID has hit, we've seen timelines extend or go lives be extended. Decisions delayed for moving to a platform, but overall we're still seeing the interest in migrating and transition to new platforms. It's just more elongated now because of the COVID.
Yeah, that makes sense. And in many cases there's a reason why they're moving. I think Jay pointed out aptly, Expanse has so many more mobile capabilities that I've seen. I've heard many people talk about those advantages as a good reason to move to Expanse. So let's talk about that transition. Obviously there's a lot of people, it's a pretty big upgrade to be able to move to Expanse because it is that next generation platform. And, what's the impact on end users, when they move to Expanse? Is their data migrated? What's the impact on the end user experience when the data is migrated to Expanse?
Sure. Yeah, like as you said, it's, Expanse is a very large encompassing project. So, adding in the side of data into that project is just another component to that. It's a huge satisfier for our customers. We're looking at customers across the continuum from ED, acute, all the way down to the ambulatory side. And, today in time, providers don't want to start without their data to treat their patients. They've invested a lot of time and energy, post meaningful use in most of their systems at this point. And today in time, we're seeing more of replacing systems versus new installs. So there's a much more, high level focus on, providers and the data that they've invested into their current systems, and they want that data in order to treat their patients going forward in Expanse.
Yeah, I mean, it would be sad to leave all that data behind, but, I've also seen a lot of discussions that, you don't, do you want to transition everything and what's the cost associated with that? So, maybe Taylor, you can chime in here. What should customers really consider as they develop this transition migration plan to Expanse? And really, what is what does the process of migrating to Expanse look like?
Yeah, it's a significant question with a lot of different answers. But I think the biggest thing that we tend to see or we recommend is that don't underestimate the impact of developing a plan. Typically, a transition to something like Expanse is significant effort, and migrating that data and determining whether you're going to archive, what you're going to archive, what you're going to migrate. Those are all decisions that take a lot of time and effort to plan and think out. And so we typically recommend that clients view this transition as particularly from a data migration perspective, as a full project within their transition plan and project to Expanse. And some key things that we ask them to think through and talk through during our sales process, but also provide materials on our website, et cetera, is that you want to develop three things for the most part. One is data governance. Second one is strong project governance. And the third one is try to identify some key physician engagement and leadership to be a part of that. From a data governance perspective, you brought up migrate versus archive. There's differences in each data set and data element, and discussions and decisions on what is best to be archived for a legal medical record perspective or migrated from a continuity of care perspective has a lot of significant impacts to the providers when they start on Expanse. And another part of that question is, how many years of data do you want to bring over? Typically, we see anywhere between 2 and 5 years of data be part of a scope for a migration, and the archival really encompasses everything else, including the data that we're migrating for your legal medical record purposes. Another piece of data governance is understanding your source systems. Do you have one source system, or have you kind of had a purchasing spree or physician groups that are on different EMR vendors? So now you're not just looking at bringing over one system, you're bringing over multiple systems. From a project governance perspective, you want to key on including a program manager or a project governance that focuses on moving the project forward to align with your go live for your transition, but also to serve as a way to communicate to the stakeholders so they're aware of what's going on, decisions that are being made, so that no one's left in the dark as far as the data that you're looking to migrate or archive. And then finally, the biggest difference we see sometimes in success for these transitions is the ability to have or include your physician leadership. The physician leaders have a big impact in the decisions that are made, and also communicating with their cohorts within the organization and colleagues to make decisions that are best for the providers as a whole. And obviously that's key for your continuity of care, because those providers are on day one are going into Expanse and seeing and working with the data that's been migrated to help care for their patients.
Yeah, and I think that's key to getting the budget as well, right? If you have the doctors on board or not. Are you saying something?
Yeah, I was going to say, I think that's a great point. Like Taylor said, there's volumes of data out there at this point, and we just don't want to bring over data to bring over data. We want to bring over data to ensure the continuity of care for those physicians when they go live on Expanse. And that's a very important decision in that overall process, like Taylor said, where we need, the overall governance from an organizational level all the way down to the physician being involved to make those decisions. So when we get to that Expanse go live, that data is readily available to treat the patients.
The worst case scenario, you get to go live, the doctor assumes the data was going to be transitioned and they chose not to and weren't involved in the decision. That's tragic, right? If you
Yeah,
don't have
yeah,
that communication.
it happens. It happens frequently, unfortunately. But it is a key consideration, and hopefully most organizations will have someone that they can lean on to provide that insight and communication. But great point.
Yeah, and I think your point's great about that. There's usually other systems because Expanse is all-encompassing, or because people have acquired other organizations. There's often other systems, and that may be a different migration path than if you're moving from a previous MEDITECH EHR to just MEDITECH Expanse. There's all these complexities that have to be considered. And I think your question of, do you archive it or do you transition and move the data to Expanse? Do you have a best practice there, Taylor, as far as, when is it best, or is it kind of case by case and preference by preference of the doctor that you have to make that decision?
Well, I think it comes down to a couple things. One is obviously budget. There are some cost considerations when migrating and archiving, but I think the biggest thing is leveraging your physician engagement to determine what data elements do they really need, or would really help them with that continuity of care. And Expanse has really provided a platform for them to migrate that discrete data over from a clinical migration perspective that to my knowledge is new for the Expanse space from a other vendor system, and that's really opened the door for these physician groups that have been on other vendor ambulatory systems to really take advantage of a unified platform that MEDITECH has put out with Expanse.
Yeah. No, I think we did a whole series together with Galen on Healthcare IT Today, so people should check that out, even looking at the liability risks of even keeping your old system or moving it to an archive solution or moving it into the EHR. So people can check that out at healthcareittoday.com. Kind of a topic for another discussion, really. But let's talk more about Expanse. And Jay, what types of discrete data does MEDITECH support for migration to Expanse?
Yeah, and I think you kind of highlighted, I'm not going to spend a lot of time on it, but we kind of have two different pathways. We have migration offerings for our existing customers moving to Expanse. And then as Taylor had talked about, we have offerings for customers that are coming off of other vendor ambulatory systems in order to capture and retain that data into the Expanse workflow from an ambulatory standpoint. So we have the ability to bring over both discrete level data and view only data, and discrete level data for types like allergies, immunizations, medications, problem list, vitals, health maintenance, and some of the family history and medical history. And then we also have a pathway to bring over some of those static images that are more document or image based.
And Taylor, we love talking about migrating granular data, and everyone would love for all the granular data to just go across smoothly and just, oh, yay, it's all good. But there's a process. To speak more about the process and why you really need to make sure you do it the right way, so you don't end up with poor data in Expanse, which that would be terrible. A new system with poor data, that's a bad outcome. So tell us, what's the process for migrating that granular clinical data?
Yeah, well, it'd be great if a magic wand could do this, right? Prior to coming to Galen, at my previous role as an IT director, we were talking about transitioning to a new platform, and I remember thinking how difficult it would be to move all of that data over and how to make it transition over to the new system so the physicians continue to see patients. And it wasn't until I came to Galen where I realized we do this for a living, and so my perspective has obviously changed. But the point of part of the point of Galen's existence is to help clients leverage that value of their data. That's what we do every single day. So that's where we can come in and specialize and provide a way to make sure we can migrate the most meaningful data over to Expanse as possible. And we do that through a couple different ways. One, MEDITECH has some great documentation for their discrete process that we've been able to leverage and get an understanding of which of the data elements require specific mappings and translations, in order to convert the source data over to meaningful data that Expanse and MEDITECH recognize. And so we spent a lot of time and a lot of part of our process and plan of migrating to Expanse and going through allergies and trying to match to their first data bank codes, or medications in RxNorm, or mapping vitals and social history to clinical queries within MEDITECH. And we see that as a need, because the translation of the source data to what MEDITECH understands and recognizes is what brings out the value and what we offer, and the purpose of the offerings that MEDITECH provides. And one thing that we've done recently is the IMO platform is a well-known problem identification platform by intelligent medical objects, and a lot of the data sets that MEDITECH supports is governed by an IMO code. And we spent numerous hours trying to map as many of those problem histories and family histories as possible, and trying to take advantage of that transition to MEDITECH for our clients. And one thing we've done is we've reached out and developed a partnership with IMO to take advantage of leveraging their existing platform to get the most amount of mapped data over to Expanse as possible. And that makes a difference when physicians go into their problem list and they have discrete problems that align with exactly what they saw in their source system. So that's one of the things that we really feel like gives the client the best use of their data, and migrating it off to Expanse. Another thing that we try to outline to the clients is, some source systems have better leverage of discrete data versus free text. A lot of times clients will find that, for sake of ease or convenience, they put in free text data that makes sense when you're viewing it on the EMR, but when you're trying to bring that over discretely to a platform like Expanse, that proves to be difficult. So we also try to work with them and advise them on the values of the free text data in their system, and how we can work with them to plan through that transition, to work with their teams to understand the value of the discrete, but also what the free text data is going to look like in their system. That's just a big part, and I think one of the things that we really focus on is not just extracting the data from a source system, but it's making sure that we transform that data and migrate it over so that it helps with clinical workflow on day one.
Yeah, and I think just to add to that, I mean, you said exactly some of those points. Not all data is treated equal, and I think that's where Galen has been very proficient from an extraction standpoint, to be able to take data out of multiple different other vendor ambulatory systems, transform that data, format it to data forms that meet MEDITECH specifications, and allow us to load that data in a meaningful way.
No, it's so powerful when you do that. And I love the free text example. That's so hard if you don't understand the problem, and how to transition that effectively. It's great that you're leveraging partnerships with IMO as well. Some standards do help. That's finally we're there, right? With some of the standards. So I think that's great. And I think you have some other examples in a white paper you published on this as well. We'll put that in the notes of the interview so people can check that out. Some other examples of why it's such a challenge to move the granular data. So you can check that out in the links that go along with the video. But I think another challenge that's worth talking about is the whole patient matching one, and really duplicates that could happen, especially if you're merging multiple systems. So, how do you handle patient matching and duplicates during the data migration?
Yeah, that's a great point. When we first started down this path of supporting migration to Expanse, I think we underestimated the value that clients saw in the patient matching and duplication process. And so that's been a focus of ours ever since we did one of the first, if not the first, migration to Expanse early in 2019. So one thing that we've really developed, and we've done this over several projects, is focus on trying to take whatever source data is available and apply it to a standardized process that we feel like gives the best results for the client. And so we've implemented what we call a 6-tiered cascading matching process, which basically means that we go from most confident to least confident as in a funnel approach, that we try to apply several tiers of matching based on most confident first and then least confident last. And so that at the end result of that process is that we have are able to make confident decisions and hand them off to the client as far as what patients match with their existing MEDITECH MPI, or if we're talking with about two or three different other vendor systems, we're able to confidently match patients amongst those different systems. And I think most clients would agree that there's probably duplications of patients within individual systems. And so we've implemented what we call a duplication queue that helps pull those out. And really the best way to fix those is to manually present those to the client for them to work on updating the source system and identifying those as soon as possible and using some type of merge capability within their existing EMR, or at least making them aware of the duplication patient prior to the migration to Expanse. But identifying those patients and coming up with the process allows us to really be as efficient as possible in getting that data to them first, because the first data that we deliver to a client for migration to Expanse is their patient index. They have to have that in order to move forward with anything else. So that's one reason why it's a priority, but also there's a lot of cleanup that usually comes from that. And so those are the processes that we've perfected to deliver that value to the client.
Yeah. And I would say, just from the MEDITECH standpoint too, that's the basis of Expanse. It's one patient, one record. So, having that key patient matching to either existing patients that already exist in the Expanse platform, or being able to determine if there's duplicates outside of the MEDITECH platform and being able to consolidate that so we get those patients as cleanly as possible into Expanse, just expedites and makes the process that much smoother.
Yeah. I mean, there's entire companies dedicated to duplicate patients, and I think a lot of organizations live as ignorance is bliss when it comes to this problem. So it's great that, I mean, it makes sense for you to address it along the way and to improve it as you move to Expanse. So Jay, what does the migrated data really look like in at Go Live? What's a typical scenario?
Yeah, so I mean, obviously our end goal with the converted data is we want to complement the physician's workflow in Expanse. So the data that we bring in, we want that to be migrated into the Expanse platform right alongside with data that would be in Expanse itself. So on day one, when the physicians start using the system, that data is there and available as part of their workflow and at the point of care when they're treating the patients.
Yeah, and Taylor, I know you guys have addressed too, like source data and being able to document that is so important. So I think it goes back to where we started, I guess. What is your process for migrating it, for knowing that the legal health record has been migrated appropriately, and all the other data that's necessary? I think that's really, at the end of the day, the end user experience should be the data's just there, but the other people are saying, but was it done appropriately? Are we covered? Is that a fair assessment, Taylor?
Yeah, that's a lot of that is really part of what we feel like our value is, our value add for our clients is we can help them address both their continuity of care, provider workflow, make their data more actionable through the migration platform, but also one thing that we address with the clients is, hey, at Galen, we can help address both of these scenarios. We can work with you on helping maintain your legal medical record, but also we can help you take the value of your clinical data and move that over for continuity of care reasons on day one of your go live. And it's one vendor. And further, one of the things that we've realized most recently is that the value of our MPI from a migration perspective directly feeds our archival and allows it to be used within MEDITECH to do patient context lookup, because we've helped them deliver and match the clinical data with the one patient, one record medical record number within MEDITECH. We can now tie in that work from a migration perspective to do that patient context lookup within MEDITECH to reach the archival for their legal medical record needs.
Yeah, and I love that you can get rid of those old maintenance costs as well, whether it's moved to Expanse or whether it's moved to some sort of archive to avoid it. I mean, it's shocking to me how many people are still paying for old EHRs they don't even use, but they don't know that it's possible. So I think that's why this is such an important discussion. Any other things customers should consider as they're migrating to Expanse? Anything we've missed?
I think it's key to just to reiterate, it's never too early to plan. Organizations typically don't do this ad hoc overnight. There's a plan to transition to a new system. And so as part of that transition plan, it's never too early to think about your data needs, as that's part of the conversation. And if you have 20-year-old servers that you're still maintaining, that's something to consider as well, and whether or not that's a cost-cutting measure and moving that to an archive. But either way, it's never too early to think about your data needs as well as your needs to transition to a new EMR for your organization.
Yeah, it can't be an afterthought.
Completely agree with that. I think, the big thing is customers can't underestimate, the volume of data and the process for considering a data transition to Expanse, and, finding that right volume of data to be able to continue to treat their patients, keep the continuity of care flowing at go live. And again, patient safety is at the forefront of it to be able to continue that as they move through Expanse.
Great. Well, I appreciate you guys sharing some insights into this process. It is so important and often is left, later. So I'm glad we could share some light on this and what the process is and what options are available. So if people want to learn more about Galen Healthcare and MEDITECH, where can they go?
Well, there's a couple places you can go. Obviously, the website is probably the most direct place, and we've spent a lot of time on working on documentation to help clients get an understanding of what their needs are and how to assess this type of transition. And so we've created a web page at galenhealthcare.com/expanse to provide a list of options for clients, which includes a link to our white paper that you mentioned earlier, John. That's really an expansive overview of what clients should consider when transitioning.
Yep, I think it's so important. Jay, go ahead.
And from the MEDITECH side, obviously MEDITECH.com provides information regarding all of our solutions, our coronavirus guidance, and information about we and what our customers are doing. So it's certainly a way you can learn more and find out anything you need to about MEDITECH.
Awesome. Thanks for sharing all these insights, and hopefully we help these people as they make the transition and really adopt a modern platform. I was able to interview at the 50th anniversary of MEDITECH, your CEO, and did a long interview, kind of the 50-year history of MEDITECH. And I was so impressed with MEDITECH's decision every decade, pretty much, to reinvent themselves. And to me, Expanse is that. So congrats to you, and thanks for sharing some of the insights as people continue to adopt these new platforms. So thanks so much, Taylor. Thanks so much, Jay. Thanks everyone for watching. If you want to find more great health IT content, you can check it out at healthcareittoday.com.